The Da Vinci prostatectomy is a robotic-assisted surgical procedure that's become the #1 choice for treatment of localized prostate cancer in the U.S. We spoke with Dr. Kamyar Ibrahimi of Glendale Adventist Medical Center, who explained this robotic procedure.
Robotic surgery is essentially an extension of laparoscopic surgery. In laparoscopic surgery, we put small holes and control the instruments by the surgeon's hands. The caveat there is that when you want to move the instrument to the right, you have to move your hand to the left because the instrument is anchored at the skin. In robotic surgery, it's as if you have your hands inside the patient, and when you want to move something to the right, you just move your hand to the right. So it's essentially miniaturized surgery the way it would have been done if I had my hands made smaller inside the patient. You have your hands in master controllers where when you do your suturing or your cutting or dissecting, you're essentially doing the same movements that you would have done in open fashion. You don't have your whole hand in there. You have small instruments that do exactly the same things that your wrist and hands does.
What are the advantages of having robotic surgery for prostate cancer?
There are several advantages that have been proven when you compare robotic surgery for prostate as opposed to open surgery for prostate. First of all, there's faster recovery. There's small incisions and therefore better cosmesis or less scarring. And thirdly, faster return to normal activity. Other potentials for benefits for robotic surgery are less pain, better continence, better erectile function after surgery, and improved outcomes with surgical margins. However, those are potential because they haven't borne out in the data.
What should a patient ask the surgeon regarding robotic surgery?
Some of the things that a patient should be aware of when seeing a robotic surgeon are that surgeon's experience with robotic surgery. Robotic surgery is just another way of doing surgery, but it's not the same as open surgery. Just like surgeons take a long time to accrue those skills to perform any surgery, open or not, robotic surgery needs to have that maturity instilled in the surgeon. So one of the things that probably the first thing that the patient should ask is how many cases the surgeon has performed.
Dr. Ibrahimi told us of his experience with both procedures.
In prostate cancer, I've had experiences with doing the prostatectomy or taking out the prostate in an open fashion and in a robotic fashion. I can say that you see so many things with the robot that you otherwise don't see with the open surgery because of the magnification and the proximity that you experience with the robotic approach. Secondly, you're able to dissect tissues that should stay with the patient, in this case nerves for erection and the sphincter for urinary incontinence, I believe better than you would be able to do it in an open fashion, simply because you're able to take your time and dissect those tissues away and take the bad and leave the good.